Sub 2 of the procedure bylaw for the Ottawa Board of Health. It would be my privilege as City Clerk and Solicitor to be the presiding officer for the first portion of the Board's business this evening. I would like to begin by asking the three new members, and it's item number 1 on your agenda, to do their public declaration of office by repeating after me. Having been appointed as a member of the Board of Health for the City of Ottawa Health Unit, I do solemnly promise and declare just the three new members. All together.
1, 2. Having been appointed as member of the Board of Health for the City of Ottawa Health Unit, I do solemnly promise and declare que je m'acquitterai.
Numéro 1. Je m'acquitterai fidèlement et impartialement de mes fonctions au mieux de mes connaissances et de mes compétences.
Que je m'acquitterai fidèlement et impartialement de mes fonctions au mieux de mes consciences et de mes compétences.
Number 2, that I have not received and will not receive any payment, reward, or promise thereof for the exercise of this appointment in a biased, corrupt, or in any other improper manner.
That I have not received and will not receive any payment, reward, or promise thereof for the exercise of this appointment in a biased, corrupt, or in any other improper manner.
Numéro 3, que je déclarerai tout intérêt pécuniaire direct ou indirect conformément à la loi sur les conflits d'intérêts municipaux.
Que je déclarerai tout intérêt pécuniaire direct ou indirect conformément à la loi sur le conflit d'intérêts municipaux.
And I make this solemn promise and declaration, conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath.
And I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath.
Thank you very much, and congratulations to the three new members, and welcome to the Ottawa Board of Health. Next on our agenda is roll call. Madam Secretary.
Councillor Stanishenko.
Présent.
Councillor Fleury.
Ici.
Member Fullerton. Here. Member Hutchinson. Member Kapoor. Member Keeley. Here. Councillor McKenney.
Here.
Membre Richer. Présente. Councillor Kadri.
Present.
Councillor Kakesh.
Present.
Councillor Taylor.
Here.
9 members.
Thank you. Seeing no regrets, any declarations of interest, including those originally arising from prior meetings? Seeing none, confirmation of the minutes. Carried. Merci. Communications, as listed in Appendix 1. Motion to introduce reports.
Item 8, motion to introduce reports that the election of interim chair and vice chair report, the medical officer of health verbal report, the draft Board of Health 2015 operating budget report, and the 2015 Board of Health meeting schedule be received and considered.
Carried? Carried. Thank you. Item number 8, election of the interim chair and the vice chair. Pursuant to subsection 57.2 of the Health Protection and Promotion Act, I will request nominations for interim chair, who will serve as the chair for the remainder of this meeting. Subsequently, at the March 2nd, 2015 Board of Health meeting, which will consist of newly appointed public and councillor members to the Board of Health for the 2014-2018 term, the determination of the chair for the remainder of the year and for the remainder of the term will take place at that point in time. In the event that more than one member is nominated today, a vote will obviously be called. At this time, I request nominations for the position of interim chair of the Board of Health for the City of Ottawa Health Unit. Any nominations? Member Fleury.
I would like to nominate Councillor Kadri as the role of the chair of the Ottawa Board of Health.
chair? Seeing none, Member Fleury, would you please read the motion to close nominations for the interim chair and the motion to appoint the chair?
That nominations for the position of interim chair be closed.
Carried.
Carried.
And the next one?
That the Ottawa Board of Health appointment Councillor Shad Kadri as interim chair of the Board of Health to serve until the next Board of Health meeting, at which a chair will be elected for the remainder of the 2014-2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotions Act.
Carried.
Carried.
Carried. Thank you all. Member Kadri, congratulations. You are elected as the interim chair of the Ottawa Public Health Board, and I will now turn the meeting over to you.
Good evening, everyone. Thank you very much, Mr. O'Connor, and thank you very much for the board for electing me as the interim chair going forward. And now at this point, I would like to ask Conseil Fleury to give us the next nomination for the interim vice chair.
Found it.
Oh.
I think it's Councillor
sorry.
McKinney.
Councillor
But so that, no, I'll let.
I'll go ahead. Yes, that Member Kapoor be nominated to the position of interim vice chair of the Ottawa Board of Health to serve until the next Board of Health meeting, at which a vice chair will be elected for the remainder of the 2014 to 2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Thank you. So, do we have any other nominations for the vice chair interim? For the second time or third time, I'll repeat, any other nominations for the vice chair? If not, I'll move that the position be closed in terms of nominations and ask Councillor McKinney to read the rest of the motion going forward and adoption.
That the Ottawa Board of Health appoint Member Kapoor as interim vice chair of the board to serve until the next Board of Health meeting, at which a vice chair will be elected for the remainder of the 2014 to 2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Thank you very much, Councillor McKinney, and congratulations, Dr. Kapoor, for the interim chair for till the next meeting. And welcome. So once again, thanks everybody, and I'm just going to read a brief opening statement, and then we'll carry on with the rest of the business of the Board of Health. First of all, welcome to everybody. Welcome Dr. Levy, Ottawa Public Health team, and new and returning members on this table. I'm honored and privileged to address you as the interim chair of the Ottawa Board of Health. I would like to thank Councillor Diane Holmes for her leadership and guidance over the inaugural Board of Health for the City of Ottawa. I think she did a great job over the last 4 years going forward in terms of setting up this board and moving the board agenda forward in those 4 years. Public health requires a multidisciplinary team of public health workers and professionals. The Ottawa Board of Health plays a key role in governing the provisions of health programs and services in our community and providing guidance on the development of local public health policy. To demonstrate the depth and breadth of the work that public health does in our community, I would like to highlight OPH's response to the extreme cold and an upcoming smoking cessation program launch. Over the last 4 or 5 days, I'm sure everybody living in the city of Ottawa and around this province are aware about the weather conditions that we faced as a city in terms of the extreme cold and the issues related to that. Ottawa Public Health does for the OPH as 5 frostbite advisories issued, and 2 frostbite warnings totaling 12 days of alert to services providers of the at-risk clients and the general public. What that really means is that the public board obviously issued those warnings and alerted these not only the staff of different agencies, but also to the public in terms of keep them aware as to how to dress and how to behave out in the cold, especially for the unfortunate in our community. Fortunately, the City of Ottawa has developed a plan to respond to the needs associated with extreme cold weather conditions for these groups, especially people who are homeless and are at risk of becoming homeless. The response is organized in partnership with a network of community agencies and groups that provide relevant service, including local shelters. OPH works with partners to offer new cessation resources in our community. This week marks the start of National Non-Smoking Week, and there has never been a better time to stop using tobacco products. I'm pleased that several board members will be on hand to help us launch the My Quit program for people who want to quit smoking. This launch will take place on Wednesday at 10:30 a.m. in council chambers. So I encourage all of you to attend that program. With approximately 94,000 residents of the Champlain region who smoke daily and want to quit, this initiative aims to help these residents quit or reduce their tobacco use through tailored quit smoking options based on their needs and an interactive website. This initiative has been the results of an excellent collaboration of partners. We're fortunate to live in this city. I'm honored to be leading this group forward with the guidance and support of both past and future new board members that will help me and help this board move forward on those programs, including the most recent one that I just mentioned about quit smoking, My Quit smoking program. Going forward, I'm going to turn the floor over to Dr. Levy in order to provide his verbal report. So, Dr. Levy, the floor is yours.
Bonsoir, good evening. Thank you, Councillor Kadri, and I could probably get away with it for another day or two. Happy New Year to you all, and welcome certainly to new councillors on the board, Councillor McKenney, Councillor Kakish, Councillor Taylor. The team at Ottawa Public Health looks forward very much to working with you. Also, congratulations, Chair Kadri and Member Kapoor, on your appointment. It has certainly been a busy winter for us. Councillor Kadri, thanks for your comments about National Non-Smoking Week, and certainly today kicks that week off. It's been cold too. Councillor Kadri has mentioned the work we do to mitigate the impacts of extreme weather events. And as you mentioned, we've already issued several frostbite advisories and warnings this winter. I don't know if people have seen, but we've issued another tonight for probably the next 3 days. I often take some tongue-in-cheek derision from friends and colleagues for issuing these kinds of alerts, but I think certainly, as you've outlined, Councillor Kadri, we do know, those of us who work on the front lines in the community know that there are vulnerable folks in this community who need outreach and need the support of our partners at times like this. Fortunately, we've had no reports here in Ottawa of serious injuries or deaths relating to the extreme cold so far this season, and I do thank our city and community partners for their efforts in ensuring that vulnerable people have the extra help when extreme cold weather hits. We do see deaths in this country relating to extreme cold. Of course, also over the Christmas and New Year season, we often hear reports about pressure on the emergency rooms. We know that throughout the year, emergency rooms see alcohol-related spikes from time to time. July, again around Halloween, and certainly Christmas and New Year, there are spikes. A lot of attention goes to influenza, of course, but alcohol-related emergency room visits are a problem as well. I do want to focus my comments, though, on the influenza situation. November, December in the Northern Hemisphere brings every year the season where we see upper respiratory tract infections. And as you know, the virus we worry about most because of its ability to cause serious illness, and especially in the medically vulnerable and the elderly to kill, is influenza. We've seen an unusually high level of influenza activity in Ottawa this season. Already we've had hundreds of laboratory-confirmed cases, and the vast majority of people who contract influenza are, of course, not even tested, so the real number of affected people is, in fact, much higher. The predominant circulating flu virus this year is an H3N2 strain, and you will have probably seen media reports that are quite correct, and I thank the media for keeping attention on this, as well as our cold weather advisories. The problem we're seeing is that the H3N2 strain is indeed more aggressive and causing more severe illness and a significant number of institutional outbreaks. And that situation is not being helped by the fact that the flu vaccine this year is proving to be less effective than usual, though still helpful in warding off severe illness. So the pattern we're seeing is not unusual in terms of who's impacted. It's the elderly population that is in fact most impacted by this flu virus. We've had about 100 people hospitalized since early December in Ottawa, and 11 people have died in the context of influenza outbreaks in long-term care settings and retirement residencies. Those residences have been particularly hard hit, the long-term care and retirement homes, with almost 60 outbreaks of influenza directly affecting about 950 people, essentially in the last 5 or 6 weeks. Other viruses have also caused problems in the long-term care and retirement home institutions, with 26 additional non-influenza respiratory outbreaks affecting almost 250 people. So you can tell this is a significant burden for those individuals, for all of the retirement homes and long-term care centers. I don't think any has been spared in our community. We have about 100 altogether. And obviously on our staff and our resourcing. So we have had to move some folks around to address these acute needs. We assist the institutions in managing these events by advising on control measures. And when the staff resources are this stretched during periods like this, that is where we realize the importance, of course, of working with our partners in the institutions themselves. So I do want to acknowledge the efforts of our team of inspectors, nurses, and doctors who've been putting in those long, long hours, but also the value of the strategy that the board approved not long ago, maybe 2 or 3 years ago, that really put a new focus on educational efforts within the long-term care centers and retirement homes, where we have increased those efforts to train staff who work in those facilities on infection prevention and control measures. It really does talk about or illustrate the team importance. So while we've been grappling with that situation over the last month or two, we've also received news from the province that I think will be of interest to this board. So just before we move on to the agenda and tabling the proposed budget for 2015, I want to remind you of the large-scale infection control lapse at a community physician's clinic, which necessitated an extraordinary investigation back in 2011. And also other challenging situations which you're aware of, including the illegal practices in a local personal services business last year that created some media interest, certainly. We've discussed previously around this table that one of the obstacles I perceived in both of the situations I've provided as examples. An obstacle to timely and efficient management of those situations was the inability of the College of Physicians and Surgeons of Ontario to share in a timely manner some confidential information pertaining to their investigations that we needed to adequately fulfill our duties under the Health Protection and Promotion Act. This appears now to almost be fixed. I think that the policy changes that are needed have been initiated, and this board was instrumental in putting those issues on the table. Last month, at the provincial level, the Bill 21, the Safeguarding Healthcare Integrity Act of 2014, received royal assent. And amongst other things, the bill amends the province's Regulated Health Professions Act to allow the College of Physicians and Surgeons to disclose relevant information to the medical officer of health in order to assist in our staff and our boards of health in meeting our mandate under the HPPA. So I'm optimistic that when those amendments come into force, we'll have improved communications between the organizations, the CPSO and local public health organizations, for the benefit of our residents. And as I've said, this is, I think, in part because of the advocacy that you did in conveying your views to the province after the 2011 incidents. So that concludes my report. As always, I'm happy to take questions on this report or on any matters relating to the work that we do. Merci beaucoup.
Thank you very much, Dr. Levy. Any questions from the members?
Thank you, Chair Kadri. Dr. Levy, I'm encouraged that the province is looking at the relationship between the, I'll say the CPSO, right? That's the right initials. And public health in pursuing some of the cases. One of my concerns at the time of the one incident was that their process did not have a proper follow-up procedure from the College of Physicians and Surgeons itself, and it seemed to leave the board, the public health unit, to, if you will, mop it up. And I wondered if they've done any looking at that particular aspect of it, not just turning over information to you, but having some responsibilities as part of their auditing process to follow through themselves.
The issue has been examined in substantial depth. There was through you, Mr. Chair. The short answer is yes, it's been looked at by working groups at the ministry, and it continues to be looked at in terms of the various ramifications. But there's fundamentally an attitude from the ministry that at the end of the day, many of these issues are public health issues when they're in the community, and the ultimate responsibilities are going to rest with the medical officer of health. The issues around costs and the issues around who makes the call on what kinds of investigations need to be instituted essentially are deemed to be case-specific and by collaborative discussion, but processes have been set up for those collaborative conversations.
Anyone else? All right. Thank you very much, Dr. Levy. And can we receive this report as information? Thank you. Draft Board of Health budget, operating budget, and again, I'll turn the floor over to Dr. Levy to table that budget. And keep in mind, board members, that this evening we're just tabling the budget, and if you have any questions, we'll wait till the next meeting of the Board of Health in order to address those questions. Thank you.
Thank you. I'm not sure what the opposite of Madam Chair is. Is it Master Chair or Mr. Chair? But anyway, thank you, Chair. So as you can see, Mr. Flaberia and Ms. Mogadam have joined us to make the presentation along with Dinah Robinson. Thank you from Ottawa Public Health. So I'll turn the microphone right over to them.
Thank you, Mr. Chair and members of the board. This evening, we are tabling our 2015 draft budget, operating budget, for your consideration. I would like to, before I begin, introduce Lou Flaboria, who is our accounts manager from our finance department, and Dinah Robinson, who is with our business services team. In terms of the outline, I'm going to just spend a few moments reviewing our mandate. Do you want to just go to, we'll just move along. Can we go to, we'll go to the en français, first slide. Okay, so we'll move to the first slide. So the presentation that I'm going to be doing, and just in terms of an outline, I'm just going to spend a few moments reviewing our mandate, covering a little bit about our funding context, reflecting on our 2014 highlights, and speaking to the planning considerations that went into preparation of the draft budget, as well as some of the pressures related to our long-term financial forecast, and then review some next steps. So beginning with the mandate, the Ontario Health Protection and Promotion Act, or the HPPA, provides the legislative mandate for boards of health and the broad array of services that we deliver. For example, under the HPPA, there are 14 mandatory programs and services that must be provided, and 21 regulations that govern areas of service such as food safety, pool safety, rabies, and communicable disease control. There are also published guidelines that we must comply to, called the Ontario Public Health Standards, or the OPHS, and those contain about 140 requirements, as well as about 27 detailed protocols. There are also other legislative statutes, about 40 of them, that we must comply to, that outline specific duties for Board of Health, and some of those would include the Immunization of School Pupils Act, the Day Nurseries Act, Smoke Free Ontario Act, just to name a few. And also, of course, in addition, boards of health can and do provide additional programs in response to local needs identified by the community. And then lastly, the Ministry's Public Health Funding Accountability Agreement sets specific performance expectations and data reporting requirements on currently 25 performance indicators. While it's not linked to funding at this time, Ottawa Public Health is required to report on performance at various times throughout the year. So the context under which we provide our work is certainly complex. The funding model for public health services consists of three main funding streams. The majority of our funding supports the provision of provincially regulated programs on a cost-shared formula, where we receive provincial funding for 75% of the costs. And as you've previously noted, the cost-shared portion has challenges, and Ottawa remains one of the lowest per capita funded health units in the province, despite our unique local context with our Francophone community, with our large rural territory, our urban Aboriginal populations, the special events that we have that are seasonal in nature, as well as unique requirements as a G8 capital city. In November, the board did send a letter to the province requesting clarification and additional information on the funding formula, and we're yet to receive a response. We also have a smaller portion of 100% funded programs, both at the provincial and the city level. And in addition, there are a smaller amount of transfers or cost recovery fees. More specifically, this slide highlights the specific programs and funding sources and with the allocation for this year. The cost-shared portion on the top left funds the provincially regulated public health programs under the HPPA. And beyond the cost-shared programs, there are several other programs that are funded at the 100% level by the province, and those are on the lower left. And those include Healthy Babies, Healthy Children, Healthy Smiles Ontario, Infectious Disease Control, and Smoke-Free Ontario. In addition, on the top right, you'll see the city-funded, 100% funded programs by the city, and these represents investments that you see as priorities. And the lower right lists out some of the fees and services that we recover. A smaller amount, but nevertheless, there are some on a cost recovery basis services that we do, health inspection searches, for example, food handler training, sale of contraceptives, and then assessment of remediation reports. So as you know, 2014 was a very busy year for us, and we really do have a lot to be proud of. While we will be presenting our accomplishments through our annual report, this is really just to give you a flavor of some of the work that we did do in 2014 and a flavor of last year's investments, such as HEAL, the Healthy Living Active Living program, work that we did in active transportation, our work with seniors, fall prevention, and our new program to prevent falls. As well, we've improved access to mental health programming to support children, youth, and parents, and we've implemented legislative changes in the tanning salons. Next slide. The Vaccine Preventable Disease Program is working together with local pharmacies, improving access and immunizing thousands of residents as part of the provincial influenza program. Also, given the number of international aid workers that we have passing through Ottawa, our emergency preparedness team led the development of an Ebola plan and training together with health sector partners and city partners. And also in 2014, we also self-improved in the eyes of Accreditation Canada, and we've made good strides in I think in the eyes of the province through the province's accountability agreement performance targets. So now to assist us in setting priorities for 2015, the Public Health Management Team considered the following. Firstly, emerging public health risks and community needs. Therefore, our draft 2015 operating budget is driven by a need to continue to strengthen infection prevention, and we will also be seeking additional one-time funding to strengthen areas related to food safety, nutrition, Aboriginal health, drug overdose prevention, and IT replacement costs. We've also given thoughtful reflection on how we can maximize our work and service delivery through innovation. We have adhered to the City Council direction that the 2015 draft budget be prepared on the basis of a maximum 2% tax increase. And the budget also considers our ability to comply with the Ontario Public Health Standards and achieving our performance indicators in the coming year. While there is uncertainty on provincial funding increases for 2015, the draft budget maximizes the provincial revenues and takes account the maximum increase for cost-shared and one-time provincial projects. And lastly, we've taken into account provisions for cost of living related to compensation under collective agreement requirements. So with that in mind, we are presenting a balanced budget of $56.4 million. It aligns with the city guidelines, and it also includes the request to the province of 2% over the approved 2014 funding level for cost-shared programs, which we assume will be the maximum increase that will be allowed. And it also assumes that there will continue to be a 0% increase on the 100% funded programs from the ministry. So that reflects a total budget increase overall of 1.2%. The next slide breaks it down a little bit further and shows you details of the draft budget, including a portrait of changes we are recommending in order to balance. Under expenditures, in the first two lines, we've, as I mentioned, included a provision for COLA related to compensation and other inflationary costs, such as insurance and lease. The third line represents a renewal of the one-time project related to personal service setting that the city has supported as a priority. As well, it also includes a portion of the city one-time projects for which we'll be applying to the province. However, in order to balance, given these pressures, we're recommending a reduction of $800,000 that appears on the fourth line in a realignment of services. So this would include 7 FTEs from removing 7 FTEs from planned vacancy, and it would also include costs related to some compensation costs related to mileage, supplies, and purchase services. Now, the adjustment line, the fifth row, reflects one-time money that is typically removed at year-end. However, this year's adjustment line also reflects the additional removal of funding for the AIDS hotline service that we provided for Ontario Francophones, which the ministry transferred to Toronto along with the funding. The lower section represents our revenues. So the 2015 revenues reflect the 2% assumption that we're making on the provincial cost-shared funding, and it also represents the 2% increase from the city. So the budget makes recommendations in two important areas. Firstly, to achieve a balanced budget, as I mentioned, we're recommending a reduction of $800,000 and a realignment of family health services. So, as I mentioned, this will include the reduction of 7 FTE planned vacancies. We're also recommending phasing in realignment of family health services with the provincial funding levels. So what that means for 2015 is that we're recommending modifying the universal postpartum telephone call and assessment to refocus on families with risk. However, we will be increasing support to lower risk families and the general population through interactive electronic media that we've been piloting over the last quarter with good success. We also will be reducing the number of small group sessions that have limited reach, and we believe that this new model has the potential to achieve greater reach in a timely and convenient way, and we will certainly be monitoring closely. Also, as I've mentioned, the budget recommends that the city continue their funding to address an issue related to infection prevention and control practices in personal service settings. And these are businesses that provide services such as body piercing, body branding, scarification, and the aim, of course, is to reduce skin and bloodborne illness. We're also recommending continued support from the city for one-time investments from the province to address some of the other community needs related to special events, food inspection, online food handler training, expansion of our peer overdose prevention program, begin looking at our IT replacement costs, and we're also recommending investment in urban Aboriginal health initiative. And finally, this slide is about challenges that will persist into the future, into 2015 and into the future, and are creating pressures for our long-range financial forecast. Starting with the non-indexing of funding, we believe this will continue. So the majority of the 100% provincial programs have been certainly non-indexed for several years, requiring cross-subsidization from other program areas. And we're concerned that this may not change. We also have some pressures around some critical IT systems that are reaching their end of life due to technical obsolescence. And we also have a requirement for patient information electronic medical records for accurate, timely service and decision-making for our clinic areas. There are also some new provincial requirements on the horizon, such as menu labeling, and there are some regulatory changes happening for long-term care, infection prevention and control, and there are also some additional accountability agreement performance indicators on the horizon. And lastly, the province will be introducing a new provincial integrated dental program where they will take the 6 dental programs, combine them into one, and there's a lot of uncertainty as to what the impact will be for us and on our services. So we will continue to monitor these pressures and examine our operations, assess options, and continue to work with the city and the province. So with all this in mind, together we've taken some hard steps to present a balanced budget to you this evening that really does reflect our best professional recommendations. With respect to next steps, we're looking for your direction to forward this draft budget as part of the full city draft budget that will be tabled at City Council on February the 4th, with public consultations the following week. We'll invite public delegates to the March 2nd Board of Health meeting, followed by the approval of the budget by the board. So we'll take questions and further inquiries from board members after you've had the opportunity to review the budget, and that can be directed to staff through Gillian Connolly. And next slide, public delegations who would like to submit comments to address the board regarding the draft budget can register by email or phone for the March 2nd meeting or attend one of the scheduled city budget consultation meetings. So that concludes the presentation, and we'll welcome questions.
Thank you very much. And are there any clarification questions from board members that you want to present this evening? Councillor Kakesh, please.
Just a question on the strategic move in terms of the FTEs and targeting risk groups. Does that mean baby well drop-in programs that are in place now that are open to the public would be cut, or is that where the targets would be, and then we'd focus on groups at risk?
Thank you through the chair for that question, Councillor. So the realignment of services will be slowly staged and is multi-phased. In terms of reaching families at risk, so that'll continue to be done through our call, telephone assessment, and home visiting. In addition, we will be looking at the small classes that we do offer in the community, and there are several hundred of those. Some of those are parenting classes, some of those are prenatal classes. For the Baby Express, we would like to continue those as much as we can, and continue to provide support to new families through those clinics, also through our Ottawa Public Health Information Line, and also through the interactive media that we're proposing through our parenting portal.
And the 7 FTEs are nurses who administer those programs through attrition, is that correct?
There are, through the chair, there are 7 FTEs. They're planned vacancies. Approximately a year ago, we began to do a financial forecast, a long-term financial forecast. So we did hold a few positions in anticipation of some of the pressures that we would be seeing.
Thank you, Mr. Chair.
Thank you very much, Councillor. Member Keeley.
Thank you, Chair, and thank you for the presentation. I too am alarmed at the same figures that are being cited by Councillor Kakish, and where those FTEs are. This is something I've spoken to before in terms of assistance to all women who have new babies in their lives, and it seems that these are the programs that are being starved. So I'm a bit concerned about it. I appreciate that you will try to do it as carefully as you can, but I remain alarmed that we cannot keep on programs like this for mothers with new babies, whether they're at risk or not. And we heard from some of them last year, as I recall, about how good the program was for them. We just shouldn't be doing this. That's my appeal. It's my last kick at the can. So I'm very disappointed to hear that this is where the cuts will be coming.
Thank you. Through you, Councillor. Of course, we don't relish presenting you with a budget that involves a reduction in FTEs. However, I would make the observation that as Ms. Mogadam has pointed out, what we've been doing is carefully reviewing realignment of service. And there have been two things that have been driving us. One is that because we think that everything that we do is significantly valuable and important in terms of addressing health needs in this community across the full spectrum of our programming, it's been very difficult to try and develop a strategic approach. And the approach that I asked the team to look at most closely is to realign the funding levels that have crept into our programming in specific programs with the original funding that was intended for them. Ms. Mogadam has spoken at some length about the 100% programming. I'll remind you on, I think it was slide 5, there's about $9.9 million which has received 100% dollars from the province, and another 42 odd million which is cost shared between province and municipality. That almost $10 million from the province has effectively not increased. Certainly the program that deals with family health, the Family Health Standard, the Healthy Babies, Healthy Children program is about $4.5 million of that $9.9 million, and has not, to all intents and purposes, had a significant increase since 1998. There was a bit of a bump in about 2008, roughly, and another FTE and a half provided about 2 or 3 years ago. But to all intents and purposes, we're working at turn-of-the-century funding levels. And it's simply not sustainable to continue to cross-subsidize into that large a dollar base on a program where, from a values point of view, we've been doing a universal program, but we're losing our ability to target individuals at high risk or families and couples at high risk. So the fundamental strategic direction that I provided and requested that the team think about was to begin to align back to the 100% levels of funding where there are 100% levels of funding. Because as Ms. Mogadam has said, we're not very optimistic that our long-range financial picture is going to be significantly better. I think this is realistically the beginning, unless the province responds to the former chair's letter, which is at the back of your report, and to which, as Esther said, we haven't yet had a reply. Unless there's some kind of significant shift at the provincial level, we're really into this now for the next few years. And so we had to come up with a strategic approach, and that was it. The only additional comment I'd make is that we've been very careful to look towards slow implementation with careful evaluation of impact and the concept of realigning services. So indeed, we may well run fewer Baby Express classes, but we'll do everything we can to run bigger classes so that we're reaching the same number of people and essentially being more efficient in our primary delivery, our delivery of services. We've definitely seen potential with the social media approaches, and we think that we can do this. Our big concern is not so much health risk as it's client satisfaction. I think we'll be able, certainly in 2015, to manage health risk in the community. We'll watch closely, obviously. That's our primary mandate and our primary passion. And we certainly want to retain our satisfaction levels from our clients. But if something has to go, it'll be satisfaction before it's risk.
Yes, go ahead.
Dr. Fullerton, thank you. I just wanted to make a quick comment before we move on. I want to commend you for the creativity and the dedication you bring continually to creating services and resources on essentially what is a shoestring budget, which is getting shorter all the time. So I'm amazed, and thank you so much.
Anyone else? Any other comments? Yes, Councillor McKinney.
Yeah, I'd just like to ask, what is the real then tax or increase to your budget if you remove the 100%, which you are getting zero on, right? So the amount that we get from the province, we get a zero increase. What does that translate into then for our public health unit?
Through the chair, thank you, Councillor, for that question. We're just confirming the number.
Okay.
Just give us a moment. Thank you.
Through you, I could wait. I think it's 2.4%, including tax and growth, on the municipal share. It's 300,000 on a 11.8 million base.
Just to clarify the question, if we could, your question is around the municipal share?
No, I mean for the full budget for Ottawa Public Health. What is then, what is the percentage increase? Understanding that, we have the provincial contribution as well as, but if we're getting zero, increases from the province, it does mean that we are not reaching our 2% target. Am I correct?
Through the chair, we're essentially getting 2% on what the province provides us on the mandated program, on the cost-shared programs right now, and that amounts to the 567 that was provided on the slide. The city also provides the 2% tax increase, so essentially as a base increase, we're getting about $800 and about $70,000 as a bump up. That $870,000 represents the increase to the mandated or cost-shared programs that public health offers. Unfortunately, I don't have a calculator right here, so I can't give you a percentage. But I could certainly provide that as a follow-up. Okay.
Yes, Dr. Cooper.
Thank you, Chair. I'm just confirming through you that we did not yet receive a reply from former Chair Holmes' letter to the Minister of Health. And while I understand that our situation per capita is different from the other public health units, the 0% increase is, I assume, is a common theme for all the public health units. And I'm just confirming my assumption that we are working in conjunction with our sister units and Alpha to press the Ministry of Health on the importance of realistic and appropriate recognition of the increasing demands on public health province-wide?
Through you, Mr. Chair, yes, there have been several representations from different public health boards and from Alpha over the years, especially around healthy babies, healthy children, but on all of the 100% dollars.
Anyone else? If not, thank you very much, Ms. Megadam, for the presentation this evening. And going back to the recommendation of the report, that we're going to table this budget at Council on February the 4th, and then from there, the public delegation going forward. So can we move this item to City Council for February the 4th meeting? Okay, thank you. Moving on to the next item, which is the schedule of the public board meeting for 2015. You should have that in your package. And unless somebody has any questions or comments on that schedule, I would ask to have that approved as a list. Oh, sorry, Member Keeley.
Thank you, Mr. Chair. I'm going to be voting against this schedule, and I'm voting against it on principle because I believe that for good governance of this Board of Health, we need to have monthly meetings. Thank you.
Thank you very much, Member Keeley. Anybody else? Dr. Kapoor?
To raise a point that's going to come up again, that I'm going to bring up again later on, it's a bit curious to be passing a timetable when almost half of the membership is not yet set, and we're not sure if there may need to be adjustments. So I'm wondering about the timing of how we're setting the timetable and not knowing if it's going to work for a large number of the council for of this board for the next 4 years, or for the next year at least. I'm not sure if we could set the March one and then tentatively use the next ones. But are we setting the day of the week and that in stone now for the rest of the term?
Our intention was to set up that schedule and move that schedule forward. But if you and Member Keeley have some concerns with it, we can refer this to the next board meeting coming up in February to discuss the item then, if that's what you would prefer.
Well, I'm interested in hearing if any others have concerns or thoughts about that. But
through you, Mr. Chair, if I may, I believe the procedural bylaw allows for, it sets the meeting schedule actually as the third Monday of every month, as required, and the frequency of the meetings can be changed at the call of the chair or at the call of the board. The schedule would require a motion around the table for a change. My opinion is that it's helpful for staff to have some predictability as to what would be expected, but we're well aware that the board has the authority at any time to change the meeting schedule if that's required, and we would do that. We would arrange for that in consultation with the clerk's office at the city and legal counsel to ensure that it's done legally given the construct of the procedural bylaw. With respect to the frequency of meetings, that's also something that can be reviewed in the context, of perhaps strategic planning and the idea of a board in terms of how much it wants to go forward with and how frequently it wants to meet. I would note that preparing for board meetings is not a resource-neutral endeavor from a staff perspective. And when you're thinking about a budget that we've just prepared, it would be, frankly, my recommendation that we go forward with larger numbers of board meetings with some caution. It can be a distraction from frontline service. I'm not saying we shouldn't have full, proper, and appropriate oversight, but we are juggling all the time on everything that we do at the staff level. Thank you.
And just for clarification, Dr. Levy, and maybe you can have an input in this, in terms of the board meetings for this term that we proposed, they're following pretty much the same schedule as the last Board of Health in terms of the Monday evenings, the third Monday evenings, as well as the number of meetings going forward. Thank you. So any other additional comments? Councilor Chernyshenko?
I would just caution from those two comments based on, I can only speak for myself, others can nod or disagree, of course, but I think if we were to increase the frequency of these meetings on Monday evenings, we would find a matching drop-off in attendance from some people for whom every, a monthly Monday night meeting would require us to just to skip some meetings as a result of other commitments. And along those lines, looking forward in my sort of quarterly schedule already, if we were to change the date, it would start to require all sorts of other changes for commitments that have already been made. So the assumption is made, as we know with each committee that we sit on, in addition to the Board of Health, that barring unforeseen circumstances where there may be an emergency adjustment, we've already planned many months in advance. So making a change would not be simple or easy.
Thank you, Councillor. Anybody else? If not, then Dr. Kapoor, if you want to move a motion, we can take a vote on it. Otherwise, we can go back to the original schedule on the meetings.
Well, hearing the comments from Dr. Levy that it can be changed as required, then I think the full and complete board can always revisit it as required. It's what I'm hearing, and so I don't have a motion.
Thank you very much, Dr. Kapoor. And as Dr. Levy mentioned, that's true in not only the board here, but even in committee meetings at council and of council, to say we need an additional meeting or an emergency meeting, and that can be called or looked at the schedule going forward. So that option is available, but from a staff perspective, I think we need to have some kind of a concrete schedule going forward. Given if there's any changes required in the future, we will accommodate those changes. Okay. So is the report carried? So
You don't have to call a vote, but I would like to be recorded as opposing this schedule. Thank you.
Anybody else? Otherwise, the report's carried with the dissent of Member Keeley. Thank you. Thank you very much. And before we go into item number 13, in terms of in-camera and stuff, there is an item that we need to put on the agenda, which is a motion that we need to put on for membership into one of the agencies that are in the city in terms of public board of health-related agency. But before we do that, I would request from the members to move a motion in terms of accepting this addition to the agenda. So. Okay. Okay. Member McKinney, if you want to move that motion, please.
Be it resolved that the rules of procedure be waived to receive and consider the report from the Medical Officer of Health titled Attendance at the Association of Local Public Health Agencies Board of Health Orientation Session, as time constraints require that a board member be registered to attend the Association of Local Public Health Agencies Board of Health Orientation Session that is scheduled for February 5th, 2015.
She seconded. Anyways, thank you. And so is that motion carried as presented? Thank you very much. And thank you, Councillor Taylor, for accepting to be on the agency and representing our interest out there. So thank you.
Sorry, Chair. I thought that was just the motion to waive the rules.
Suspend the rules?
To introduce the report? Or did we just vote on the report, approve the report itself?
Well, we had moved the motion to suspend the rules. That's
Okay.
what Councillor McKinney did. And then after that, we did go in and approve the moving forward of Councillor Taylor sitting on that board. But if you have a comment, we'll accept that comment and go from there if you like.
I did have a question. This is for the orientation session. And so I notice the point I foreshadowed earlier is that we've appointed, the City Council has appointed the 6 councillor members of the Board of Health, has not yet appointed the 5 non-councillor members. So I notice Alpha's timing for their new board member orientation session is February. So my question is whether Alpha is out of step and is premature with holding an orientation session, or is the City of Ottawa out of step and we have so delayed our process for appointing non-councillor members compared to all the other boards of health that we are out of step. And so I'm trying to figure out why there's this disconnect, because we're going to have up to 5 councillors who are brand new to the entire process. It sounds like it would have been useful to consider sending more of them if we knew who they were. I'm not sure whose timing is off, Alpha, or if we're out of step with the other 30-odd units.
Thank you. Through you, Mr. Chair, the short answer to that question is it's Alpha that's out of step. They've realized that next time round they should do this 2 or 3 months later. From our point of view as your staff, we think the Alpha orientation is useful as an addendum to the orientation which we provide and will be providing to all new board members in late February if the council appointment schedule holds. So you're absolutely correct. It's a problem that's cropped up for many boards around the province, and Alpha had to think about whether or not they wanted to reschedule. They decided to go ahead.
So is the report carried? Carried. Thank you very much. Moving on to item number 13, the in-camera item. There is no item. Councillor McKinney, would you? Yeah.
So motion to adopt reports that the election of interim chair and vice chair report, the medical officer of health verbal report, the draft Board of Health 2015 operating budget report, the 2015 Board of Health meeting schedule, and the attendance at the Association of Local Public Health Agencies Board of Health orientation session report be received and adopted.
Carried. Thank you. Number 15, motions on which notice has been given previously. There are none in terms of that item. Number 16, motions requiring suspension of the rules for procedure, which we've already gone through in terms of the last item. Back to Councillor McKinney in terms of notice of motion for consideration of subsequent meeting. There are none. Oh, you have one? Sorry.
I have one more that's more technical. All the boards that I've sat on this new term have passed a policy for paperless. We talked about it briefly. I wonder if that requires a full motion or if we can give a direction on that. I'm comfortable with both.
I'm okay with direction, but I'll refer it back to Dr. Levy to see what his consideration would be.
And I immediately glanced at Ms. Connolly, who nodded, so we're fine with taking the direction. Thank you.
The only thing I would say, learning from another board that I sit on, would be that we have a central spot where all the members can backtrack on reports, not just the public piece, but also motions and so on. So just have like a Dropbox account or so on that every member can access. Thanks.
Thank you, Councillor Fleury. In terms of the information previously distributed, there was items there in terms of making healthier choices at number 18, and Is there any comments on that, or we just move forward because there is an IPD? Okay, thank you. Number 19, confirmation of bylaw, Councillor McKinney.
That bylaw number 2015-1 be read and passed. A bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Board of Health at its meeting of January 19th, 2015.
Carried. Thank you. In terms of inquiries, there are none, unless somebody has an inquiry. No. Other business? Yes, Madame Richer.
As a question of privilege, and considering it's my last meeting, may I say a few words?
Please.
At the board, we have no exit interviews. And you mentioned at your welcoming notes that we had a good term for the first board, and I agree with you. But there is something that has been a concern to me for the 4 years. There are no staggered terms of office for the members here. And I think that for good governance, it is extremely important that terms be staggered. It provides for succession and also for corporate memory. And I think it is extremely important, and I don't know how many of the actual community members will be seeking re-election. I know I'm not. And also, in November, I received a letter for committee and board recruitment. And in that letter, it mentioned that any of the actual board members had to go through all the nomination process, reapply, send all the your CV and everything, and go through another interview. Well, over my career, I've had numbers of nominations, both federally and provincially, and never in my life was I treated that way. And when I say I, it's not I, it's all the members. Usually, at the end of a term, even the minister would call and say, are you interested in having a second mandate? Or do you want to quit now? And if they didn't want me to continue, they would have something very candid to tell me that they didn't want me anymore. But to receive a letter like this, and I have a copy of it, I don't think that this is a good process. And I replied to that letter, and I gave some comments and saying that the process was flawed. And as a taxpayer of Ottawa, I feel that this policy should be changed. So I hope that when the city, the people who will interview for community members will take this into consideration. And also, I think that for the councillors who sit on this board, it would be also very helpful if the terms were staggered. So these are my few things that I meant to say before I left. Also, I feel that this board should be more autonomous because health is for everybody. And with all respect to politics, I feel that it should not be so political. Because for 37 years, I've been involved in the health field, and this is where I had my career. And you know that the learning curve at this board is not simple. And on top of having all the problems that we have and all the programs that we have and all the acronyms that we have as well, it is extremely important that people learn. Fortunately, we had the privilege to have good staff led by Dr. Olivier, and I wish to thank the staff and all my colleagues on the board. Thank you.
Thank you very much, Member Ishe, and I listened to your comments, and I really seriously listening to your comments in terms of what you expressed this evening. Going forward, I think those are some of the comments that you made will be, looked at going forward. But in terms of a legislative agenda that we have to follow, and we're mandated on that, that's where some of those decisions are coming from. And, going forward, we'll take a look at and see if some of them
And
needs to be hit.
I just want to mention, Mr. Chair, that it's not in a negative way, because I made these comments to be constructive for the following boards. Thank you.
Thank you again, and thank you not only for your comment, but thank you for, almost 4 years of service on this board, so thanks very much. Any other business? Oops, sorry, Dr. Kaler.
Thank you, Mr. Chair, and thank you, Madam Richer. I endorse the statements that you made. Excuse me, I seem to have lost my voice. I do think some issues around procedures, what what the legislation does and doesn't allow, need to be looked at in order for this board to be really effective and to support the staff and council in the way that we would like to do. Staggered terms, dealing with policy issues, regular board meetings every month, all of these are related, and I endorse certainly what Madame Richer has mentioned. Thank you.
Thank you very much, Member Kelly, and thank you also for your service over the last 4 years on this board. In terms of the comments that both Madame Richer and you have made, I will go out and get some legal opinion on that from the city, and probably come back with a written statement at the next board meeting. Okay? Thank you. So if there is no other business, I'd like to call for an adjournment. Whoops, sorry, Dr. Kapoor.
Sorry, Chair, not knowing whether this is my valedictory or not, I would like to simply thank Dr. Levy and his staff for their help. And I know it's been new for us as a first term of a board, and it's been new for the staff and Dr. Levy as having to deal with the Board of Health for the first time. So I just simply want to say my thanks through you to them.
Thank you, Dr. Kapoor. And, again, as a board interim chair, I want to thank each and every one of you that is sitting around the table for their second term going forward. And thanks for your service and your commitment to this board and your input into this board. So thanks. Member Fullerton, did you want to add anything to it?
Ditto.
Thank you. Okay, can we call for an adjournment of the meeting? Let's not debate this. Thank you, Councilor Fleury. And our next regular meeting is on March the 2nd. So thanks, everybody, and enjoy your evening, and we'll see you at the next meeting.